When you guys were on call, what was your least favorite thing to be woken up by?
I did have to see a patient for like herpes in his eye, so that wasn't very pleasant.
I am a doctor.
5 are posers.
What?
1 is the real deal. In a room full of liars, can these teens find the real deal?
What?
So, how are we feeling?
Oh, we're feeling good. We're feeling good.
Yeah, I feel like maybe a little more confident than I should be now that I get a look at you.
They ain't ready.
If you have herpes in your eyes, you've gone too far. You probably can't see your way back, but you should turn back anyway.
They ain't ready. Okay. Numbers 1 through 6 in that order. Could you tell us your specialties and what school you went to?
I'm a dermatologist and I went to UCI.
I'm a urologist and I went to University of Tennessee.
I'm an emergency doctor and I went to UCF as well.
Physical therapist, Rutgers University.
I'm a pediatrician and I went to Drexel University.
I'm an optometrist and I went to Southern California College of Optometry.
Number 6, can you tell me what 20/20 vision means?
Yeah, so basically it's kind of complicated. There's a lot of like physics to it, but there's a certain angle that's subtended by the letters that are on the Snellen chart that you're looking at. And so they standardize that at 20 feet distance. So if you're 20/20, you're seeing what someone should be seeing at 20 feet. But if you're 20/30, what someone can see at 30 feet, you need to be standing at 20 feet in order to see.
When you guys were
What?
on call, what was your least favorite thing to be woken up by?
During my residency, I actually had a case of Stephen Johnson's, and that was very scary to see.
A large accident with fatalities is always a grim scene to come into, especially if children are involved. So that's the worst thing that I've ever had to do.
I got a little bit annoyed with the Tylenol call, but you know, I had to do what I had to do. So.
My emergencies are mainly during like a practice or a real game. I've had ankle injuries that needed to be like lowered inflammation and put ice packs or certain, massage therapy.
I think just seeing any babies in pain and then
Guys, I'm notoriously horrible at these guesses, so I'm going to keep it to myself until I have a really good one. But for you guys, you could put it down in the comments below and be shamed and own your shame when you're wrong, just like me, okay? Do it. Don't cheat. And by the way, like, comment, and subscribe, and subscribe, and subscribe. Thank you.
seeing like a tragic loss is the hardest thing.
I haven't been on call as much, honestly, but I did have to see a patient for like herpes in his eye, so that wasn't very pleasant.
I think you'd be thinking.
I
Think
know,
what I'm
you're
thinking.
thinking what I'm thinking.
Oh, I'm thinking what you're thinking.
Okay.
We're ready to make an elimination.
Each team will try to find the real deal by eliminating
Who are you guys eliminating? Put it down below.
the imposters. If both teams eliminate the same person, they will be removed from the game.
When you ask about why they don't like being called at night, it's so sad, and the
He was
children, and
stumbling.
this like general thing, I was like, okay, that's nice, but meh.
How long have you been practicing since, well, you're still in residency, so since out of residency?
I have been out of residency for a little over a year.
I graduated in 1993 and went right into work, so
You need to find a doctor to fix that
28.
throat.
I graduated medical school at 2021.
I've been practicing for 15 years.
I finished my residency at USC Medical Center 5 years ago.
And I've been out of school for 1 year.
Doctor number one, I have a question. For the medical terminology, intra versus inter, since you're a dermatologist, what's the difference?
Yeah, so it has been a while since I've been in medical terminology, but I definitely use inter a lot, and that would be inside. And then intra, gosh, I don't remember off the top of my head.
Doctor number 4, can you name me the different kinds of cruciate ligaments?
3? You said 3?
However many there are.
Oh, we got the anterior, interior. You have a meniscus. Those are the main for knee.
Gotcha.
Doctor number 3, what system is the lymph nodes a part of?
The lymphatic.
What does that mean? This is what I have a very strong feeling. She asked a question she didn't know the answer to. So if he could sell it, that's all he needed. Sell it. Say it with confidence. He could have said broccoli, asparagus, and mixed beans. She doesn't know he's wrong. She didn't know the answer either.
System.
Are we allowed to eliminate 2?
No, just one.
Okay.
Ready.
My timid guess right now is going to be the person on the far right.
As a reminder, if both teams eliminate the same person,
So that's number
that
6.
person will be removed from the game.
When I asked him to name me the cruciate ligaments, and he answered with
Meniscus.
which is not a cruciate ligament. As a
Shut my mouth and call me Sally. She actually knew one. I apologize. I've been humbled.
physical therapist, you should probably know that.
Doctor number 5, could you tell me a common medication that you prescribe for one of your patients?
Benivate, it's for babies that have phimosis before they get circumcised. We try that method first. An average is like 50 milligrams.
Doctor number 5, I had a question for you too. For a baby under 28 days, if they had a fever, how much Motrin would you give them?
Ideally none.
Ooh, she knows her stuff. Okay. Go ahead.
Doctor number 6, if a patient had glaucoma, what kind of prescription would you give them?
You could give them something called latanoprost. So it's an eye drop. You do that one at nighttime only, in whichever
Yes.
they had the glaucoma.
And then what would be the abbreviation for nighttime only?
QHS.
That's my
Our
girl.
resident, number 3.
I'm
Can
finally
you
gonna get
tell me
one right.
what a normal blood pressure is, and then kind of explain to me what those numbers mean?
120 over 80, and 120 is a systolic, so pretty much the amount of blood that's in the chamber before it's ejected, and then the bottom number is basically the resting volume.
1 and 4, could you tell me what kind of cars you guys drive?
Serious? I drive a Toyota Honda Highlander.
So I have been driving the same car since I was
Toyota
15.
Honda.
I drive a Honda CR-V. I am still paying off medical school, so I will be driving that until it cannot be driven anymore.
I think we're ready to make another elimination.
In this round, both teams have decided that one person is definitely not the real deal. Number 4.
We'll miss you.
Thank you. I would love to hear your wackiest story from a patient on the job. Down the line, sorry, I'd love to hear from all of you.
So we had a TikTok star in one time, and when I entered the room, he was standing on the medical bed, filming something, pretending he was surfing. So that was definitely very interesting.
It was a vaginal occlusion. She and her friend had been playing around with a bottle and created a vacuum, therefore lodging the bottle in her vagina.
I had this elderly patient. She has some sundowning, some form of dementia.
It's
but
believable.
she kept asking me to go to the bathroom with her to show her a good time.
A mother asked me, is it okay to put false eyelashes on her newborn baby for pictures?
For me, I had a guy come in because he was playing with a Nerf gun, and then I guess he got hit in the eye, and then he ended up having like traumatic uveitis, and then he got some glaucoma as a result from that. So that was pretty crazy.
Nerf or nothing, right?
Yeah.
You got a lot of eye stories. Come
All
on,
right,
girl.
we're good to eliminate.
Over the top.
Doctor number 2.
Sorry, sir.
Thank you.
Next time.
Bye-bye. So we eliminated number 2 next because there were very broad answers given. It wasn't very specific to what a urologist actually does.
So this is a question for doctors 3 and 5. You walk into the room and you see the patient's monitor flatline. You feel their pulse, there's nothing there. How many joules are you going to shock them with? Doctor number 5.
5.
And doctor number 3.
200.
Doctor 1?
It has been a while since I've been in the ER. I am a dermatologist after all, but if I remember correctly, it's a
Bye, girl. You're done.
And Doctor 6?
Yeah, so I definitely don't work in the emergency room, so I don't really work with that. I'm not sure.
That's fair.
Okay. That was a question everyone got wrong. The answer is none, because you don't shock asystole. But that's something medical TV sometimes gets wrong. Everybody comes in there with the paddles ready to go.
Has to have the right
I don't know who's
I don't know
rhythm.
anything
the real
anymore.
deal at this point.
Yeah, I know that one. Yeah. Now I do.
Okay, I have a question for doctor number 3. So earlier I asked you what system the lymph nodes are a part of. You said the lymphatic system. What's the major system that it's a part of?
I know that
Any of you
I know
guys
it
get these questions,
recycles
or
like
is it just me?
dead cells, fights off infections and whatnot. it's like at the tip of my head. I'm just like nervous right now, so I can't.
Doctor number
really
one,
think- really
do you
think
know what
about
the
it.
answer is?
I believe it's the circulatory system.
Doctor number 6, do you agree?
The immune system.
Sweet.
Like-
Okay.
Doctor number 5, what is the average heartbeat of a newborn versus a 1-year-old?
For a newborn, it's lower, so maybe like 35 beats per minute.
I think it's
It
higher.
elevates by the time they're 1, obviously, so maybe like 40, 45.
No, that's
Okay, I'm ready to
reversed.
make an elimination.
I think
I'm
it's
ready to, yeah.
reversed.
Okay.
Doctor number 5.
Thank you.
She talked about the heartbeat for a baby. That gave it away.
Yep.
She answered that a resting heart rate of a fetus or infant is 35.
It's one like
which
150.
It'd be
something, I
very
think.
concerning if it was that. They'd be not alive.
Okay, I think we're gonna have a demonstration. I was just gonna have Dr. Number 6 do a little eye exam with my pen light on Andre.
Okay.
And tell us what she's looking for.
Let's see what Dr. Number 6 got. Is she a pro or not?
See those skills in action.
All right, so first I'm gonna be checking to see if your pupils are equally responsive to light and if they are equal in terms of size. I'm gonna do the direct response first, so just look straight ahead for me, please.
I think
So
she's
when
the
I
real
shine
deal.
it between the two
I
eyes,
think I'm
looking
finally
to see
about to
if
win
the other
one,
one stays
guys.
constricted because that
finally
means that
about
there's
to
like
win.
a good communication between like the brain. So that's what I'm looking for.
Very knowledgeable.
Okay, Doctor Number 1.
I also believe that she's the one because she's not as scared to say, I'm not sure. Okay? Think all you want to think about these doctors, but a lot of these doctors, sometimes when someone comes in, you know what they go looking? A textbook. Prove me wrong.
Can you tell me what medication you typically prescribe to patients with cystic acne?
Yes, so if the acne is bad enough, we're going to put them on Accutane, but that is a high-risk drug, so we have to make sure that the women come in every month and give us a pregnancy test. And then I also recommend to not drink very much when you're on that medication, and that goes for men as well.
Last thing, does a bar of soap clean the face pretty well?
It can, yes. I have some patients that don't even use soap when they wash their face, and they have beautiful skin, so it kind of just depends on your physiology.
Thank you.
We're locking in the real deal.
Yep.
Doctor number 6, what is that machine called that blows air into your eye?
Yeah, so that's called it's a non-contact tonometer. It measures your eye pressure to screen for conditions like glaucoma.
The cones that are in our eye, what do they do?
So they help you perceive color.
What colors do we see?
Okay, sorry, I'm trying to think. Red, green, and yellow.
Doctor number 3, talk me through intubating someone.
I'm not
What
sure.
are you trying not to accidentally push it down?
I thought it was
instead?
blue.
You're not trying to push down the tongue so that they don't or it doesn't block the airway.
Okay. I'm gonna ask one more question real quick to Doctor number 1. Somebody has a mole. They want to get it checked out. What are some things they should look out for?
So changes in shape, color, if there's any pain, that's definitely something we want to know. And then throughout the mole, if there is different kinds of colors and textures, that's something that we want to look at as well.
That is all I needed.
One of you is a real doctor. The other 5 of you are going to jail for impersonating a doctor.
Final guesses, guys. Put it down below. No cheating either. I'm watching you. Like, comment, subscribe.
We think the real deal is Doctor Number 1.
Dermatologist.
Really?
We think she was knowledgeable about everything that she explained. She didn't really know the jewels, but like she said, she's not in the ER very often.
We think the real deal is Doctor number 1. She didn't fumble on any of her answers, and the more that she kind of got into it, the more I felt that
Now I'm nervous. Am I going to be wrong again, guys? Again.
she was a
Again.
doctor talking to me as a patient.
In the event that both teams lock in the real deal, the team that locked in their guess first wins.
If the lights on the floor turn green, that means that you have chosen the real deal. If they turn red, that means that you have chosen an imposter. The real deal will be revealed in 3, 2, 1.
Yes! Oh! Did I win? Did I
Yes.
win?
Hello, teams. My name is
Did I
Rebecca.
win?
I am not a doctor. I was in the medical field. My original plan was to be a PA, but then I left medicine. I went and got my MBA, and now I'm in marketing. I stopped working in healthcare 4 years
Was I
ago,
right?
so it was a bit
Was
of a
I right?
memory kind of situation. I was an MA for dermatology and plastic surgery private office.
Because you were not able to find the real deal, we will reveal them to you.
I won! Losers! I won!
was right
You
there.
lost? Own your losing, okay? Put it down below. I won fair
I
and
am Nicole, and
square.
I'm the real doctor. I think some
Fair and square. Okay? Like, comment, subscribe. See you in the next one, losers. Bye.